Hi everyone, today our team will be discussing the impact of dating and domestic violence on young adult women's mental health and how we can address it in the healthcare system. Dating and domestic violence, or DDV, can greatly impact the mental health of young women. DDV is a critical public health issue with survivors experiencing disproportionately high rates of mental health disorders. Specific research show that 40 to 60% of survivors develop depression, 50 to 80 experience PTSD, 30 to 50 are diagnosed with anxiety disorders, and suicidal ideations and attempts occur nearly twice as often comparing to non-survivors. These conditions don't exist in isolation. They can also disrupt the survivor's personal, academic, and professional development. And without targeted intervention, survivors may struggle with emotional regulation, maintaining interpersonal relationships, and achieving academic and career success. So to address this issue, we need a couple comprehensive strategies, which include, number one, expanding access to trauma-informed mental health services to provide specialized care for survivors. Two, enhancing screening and early intervention to identify and support these survivors before their mental health deteriorates. And third, addressing systemic inequities that limit healthcare access, and especially for the marginalized communities. And lastly, to strengthen collaboration between healthcare providers, policymakers, and community organizations to create a multifaceted support system. And by implementing these strategies, we can work towards the long-term mental health impact of DDV and support the survivors in their recovery.
Now we'll get into the analysis of dating and domestic violence support. So there are a couple different strengths that we'd like to hit on today, starting with family support. That allows frequent contact with family members that will offer survivors of DDV comfort and guidance towards seeking mental health care. Next, confidential care. The increased availability of confidential medical exams such as sexual assault forensic exams and rape kits, they are protected under VAWA, which stands for Violence Against Women Act, and that allows survivors access without having law enforcement involved. And the next and last strength, community-based programs, which will provide trauma-informed counseling, peer support groups, and preventative education through partnerships with schools, universities, and other local organizations to expand outreach. And now we will get into some weaknesses that come with DDV support. Starting off with the first one, limited access to resources. Unfortunately, there's challenges with medical insurance and housing that can sometimes limit access to mental health support. And the next weakness is there's always a fear of retaliation. Some survivors may hesitate to seek help due to the fear of retaliation from perpetrators. Then we would like to hit on social stigma. Unfortunately, there's been a normalization of toxic relationships, which makes it harder for victims to seek mental help. And lastly, we would like to hit on system shortcomings. Unfortunately, overburdened shelters and inadequate law enforcement training hinder DDV aid.
So based on those considerations and all the pros and cons listed of how to help dating and domestic violence victims, we propose a plan of action in order to mitigate the amount of mental health disorders amongst this population. Firstly, with any issue this widespread and this common, it is always better to be improving our knowledge regarding this topic and how to help the issue at hand, which can be done through diverse research. We can partner with research institutions to share data on the prevalence of mental health disorder in DDV survivors through publications and research conferences. Furthermore, we can use that research to improve the health education of the general public. We would use the findings to promote mental health education and advocacy in community spaces such as universities, workplaces, group gatherings, to spread awareness of the situation. And lastly, another important feature of our plan would to improve medical professional training regarding mental health disorders for young women who have suffered through dating and domestic violence throughout the whole healthcare industry. So this would mean creating a certification program for healthcare professionals on mental health topics and how they can best support and help DDV victims. So to go into more details, the goal is to ensure that these healthcare professionals who undergo this training are knowledgeable, reliable, and supportive when dealing with victims of DDV, which can hopefully improve the mental health of such patients in the long run. They would be trained on how to recognize and talk to these victims, how to engage patients in current resources, and how to further workers and peers on ways to build support systems. To further incentivize healthcare professionals to undergo this new training, we would make it online so that it's easy to complete at their own pace, on their own time, and hopefully will have enough stimulations and examples that they can use it and apply it to their real-life practices. In addition to that, we hope to make this an official certification process so that once they complete the training, professionals can use the accreditation to enhance their own personal qualifications, such as on their CV or resume. And as with any new program that we're trying to implement, it's going to take time, and it might take even a few years to really incorporate this program into the healthcare industry and to see the results of the training. We're hoping to evaluate the effectiveness of this whole program by conducting surveys done by the patients and or providers regarding their interactions, how they feel regarding the topic itself, and stuff like that, in order to really see whether this program can help improve mental health outcomes and mental health care amongst DTV victims, especially young adults.
Interprofessional roles and responsibilities are crucial to establishing enhanced screening and early interventions for domestic violence survivors. With a strong collaboration between multiple disciplinaries, the healthcare system can work as a team to provide the proper care and resources to these victims. Physicians play an important role in identifying signs and symptoms of abuse and can conduct domestic violence screenings. Doctors can improve their approach and skills to address sensitive topics with their victims and write referrals for other interventions. Nurses engage in identifying abuse as well as work to implement patient plans and provide emotional support. Pharmacists are an important source of knowledge and trust when prescribing and educating patients on potential medications for mental health conditions acquired from their abuse. A very common and crucial referral for domestic violence victims are mental health professionals. This can include psychiatrists and therapists who play an ongoing role in the patient's treatment to address traumas and provide therapy to heal and overcome the challenges they have faced. Overall, a group of healthcare professionals work together to address both the physical and mental damages and aspects of domestic violence to care for the overall health of a patient.